Massachusetts has recently been named the best performing health system for women overall. The Black Women's Health Study at Boston University has led the largest and longest running study in the country with over 350 publications, and they've worked to raise awareness while even exposing what health providers are missing when caring for their Black patients. Joining us now is Dr. Kim Thornton, reproductive endocrinologist at Boston IVF and Beth Israel Deaconess Medical Center, and Tracy Griffith, Racial Justice Program Director at the American Civil Liberties Union. Thank you both for joining us. Tracy, I want to start with you. So Massachusetts received high marks for women's health overall, but what do you know about how the outcomes for women of color? What are the outcomes?
Well, we know that there are disparate outcomes, particularly for Black women and other women of color, Indigenous women. We know that Black women are suffering, that there's a lack of access, and once they get access to that health care, the outcomes are often not quite as good as other women in our Commonwealth.
Is there enough research being done on bias in women's health care based on identity to treat patients more equitably?
There are studies being done, but what we already know is that those disparate outcomes are affecting everyday lives. They're affecting Black women who have to travel farther distances to get access to maternal health care. That we know that the studies that are being done reveal that a number of these women are experiencing problems in giving birth, in the year after giving birth, and in the health care that they receive. So we know the information's out there. It's really, what are we going to do about it?
Kim, so much talk in the news now about IVF. How does the experience of Black women going through fertility treatments and through the IVF process differ from their white counterparts?
One of the things that we notice is that Black women and other women of color oftentimes present much later for fertility care. So that has a significant impact on their outcome with regards to pregnancy rates as well as their obstetric outcomes. One of the initiatives we would like to see is for more education to encourage patients to come in earlier for their fertility care. And often that has to do with the education they receive in their primary care or general OBGYN offices with regards to what their reproductive plans are, so that they can seek care sooner.
Is cost and also the kind of health care you have impacting women of color disproportionately?
Absolutely. One of my colleagues, Dr. Ann Korkodakis, did a study looking at some of the factors that impact women of color, both Black as well as Hispanic women of color. And in Massachusetts, where we have the best insurance mandate in this country, Black women have either, or more likely to have inadequate insurance and therefore still seek care less frequently. In addition to that, we were able to identify that Black women and Hispanic women, as compared to Caucasian and Asian women, lived in areas where there were what we call area deprivation regions, where there was either inadequate housing or food or transportation, and that affected.
So they couldn't even get to the place to do the IVF. So Kim, obviously a woman of color yourself in this field, what have you brought to the process that differs from your colleagues, and how do you think that's impacted the outcomes?
One of the things that I'm doing more nationally as part of being a member of the American Society of Reproductive Medicine and on their DEI subcommittee, we're working to really increase access to, or rather increase the pipeline of reproductive endocrinologists, embryologists of color, nurses of color, mental health professionals, hoping that that will not only increase access to patients, all across the country, but also make our patients feel more comfortable when they're coming into fertility centers. So they're seeing people of color who look like them, they're more comfortable accessing
reproductive rights is, as we said, a hot button issue now in this election year. Tracy, how has the ACLU expanded and protected reproductive care for women?
Well, so the ACLU of Massachusetts in particular, we know that reproductive rights and reproductive health is a huge issue, particularly during this election year, but at all times, right? Making sure that access is equitable, making sure that, as an example, we are a member of the Bay State Birth Coalition. This coalition has been working for years, right, to get midwives and the ability of midwives and people of color to access midwives in a more equitable way. And so we're doing work to make sure that reproductive health includes access, includes the ability to choose how you decide to seek that care.
What policy work is underway to improve outcomes for women's health?
Right, so the coalition, with our help in the legislature, has recently put a bill before our governor, and we're hoping that she will sign it. And this bill is really geared towards making sure that midwives are equitably paid, making sure that there's more access, that birth centers are more available to women of color, and we're hoping that she will sign that soon.
All right, very quickly, Kim, from fertility treatment through pregnancy, how can women of color ensure they're getting treatment that protects their health and their lives?
Well, I think asking questions of your provider is key to make sure that you discuss what your reproductive planning is earlier, and then make sure that you advocate for yourself so you can get in to see a fertility specialist sooner, to make sure that, you know, things like identifying whether you have uterine fibroids, or identifying whether you have a tubal factor, or if you have a partner, identifying whether there's a male factor earlier in the process, so that your outcome can hopefully be
Take someone
better.
with you. Don't be afraid to ask questions.
Absolutely.
All right. Kim Thornton, reproductive endocrinologist at Boston IVS, and Tracy Griffith, Racial Justice Program Director at the American Civil Liberties Union. Thank you for your insights. Thank you both. And thanks to all of you for watching. Be sure to follow us on Facebook, Instagram, and follow me on X at Karen Holmes Ward. You can watch the show on our very local app. It's free to download on your phone, tablet, or smart TV. Have a great afternoon.